So here we are in 2014, and it's an interesting decade. Already, there's all kinds of conversation about the Affordable Care Act, or depending on which side of the political spectrum you're on, you might call it Obamacare. It's always a conversation starter in my clinic and something we're talking about constantly. Hardly a visit goes by these days where people don't pull out some kind of a cell phone or a smartphone and show me an app that they have, whether it's Lose It or they've got something on their wrist or their belt, Fitbit perhaps, and they're showing me how much they're walking and keeping track of things. And certainly that's a certain strata of my patients. So what I'd like to do to start off our conversation is to think about where we are now in 2014, thinking this sort of interesting decade that we're in, and imagining what a clinic visit, an outpatient visit might be like in 2020, so just 6 years from now, but it kind of bookending this decade. So if I could, I'd like to start right next to me with Dr. Deneen Vojta and get your thoughts on this. You're a pediatrician by training, is that right?
That's right.
So what are your thoughts?
So I think, first of all, 6 years is not a long time. And so if we're going to say, well, what will be different in 2020, I believe it will be the will of the people. And so if I sit back and think today, how many people in this room don't have a cell phone or smartphone right now? If you don't, raise your hand. Okay, so nobody. So, and right now you're collecting a lot of information about yourselves, right? So even if you have GPS enabled, I can tell you where you've been, did you go to work? There are all these apps people use, who checks the weather and why, how much you're traveling. And I think over the next 6 years, people will continue to, what I say, lay their behavioral blueprint. Much like your genetic blueprint, right now we can send away for that real easily. Right now each of us are laying our behavioral footprint with our smartphones. And I think within 6 years you'll begin to share it openly. And so, for example, in the practice, if I'm treating you for depression, and I say, okay, well, I'm going to start you on Wellbutrin at X dose, and I'll see you in 3 months. Is that still standard? Okay. Well, lots of places it'll be 3 months, so that's interesting. A big change here in Minnesota might be a month. But around the U.S., it'll be 3 months. And then you're going to come back and I'm say, how you doing? How you doing? But I think within the next 6 years, you'll know how I'm doing, because I'm going to enable you to say, every day I'm going to wake up and there's going to be an app, and it's just going to be different. Remember the smiley faces in kindergarten? Which are you today? And you're going to know that actually, I used to always be frowny face. And actually, most days, I'm okay. I'm a happy face. And you're going to know that I used to walk before, 3,000 steps a day. I'm actually walking 10,000 steps a day. So then you're not going to say, how are you doing? You're saying, I see you walk more. And I'll say, you know what, I went back to work.
Sure.
Now, isn't that much more useful information if I'm treating you for depression? Your smiley face a lot of times, you're back to work. So even though you say, well, I'm still not feeling well, I actually have objective data that you're actually doing a little better. And so let's talk about that instead of just the bland, how are you doing? So I'm real excited about that.
Thank you. Reid.
I think one of the most common things that we've had folks talk to us about is really bringing the consumerism side of things to healthcare. So if you think of where we were 10 years ago in terms of online retail with the early days of Amazon, and if you look at where we are today in terms of the data that is collected, shared, understood about you, able to target certain either product sets or looking forward at healthcare, even being able to start to think about what kinds of engagement pattern might actually work best for you, based on the fact that you've bought a lot of outdoor gear recently, maybe and oh, by the way, you're also an asthmatic. Maybe we need to think about prior treatment for during certain seasons to keep you away from high pollen counts, or thinking about things like that. I think the amount of information that'll be understood and known about the patient community and the consumer's engagement in that information sharing will change dramatically how care is, not necessarily how care is delivered, but where the theaters of care actually are. I think that's what I see. A lot of that stretching outside of the walls of the traditional healthcare system. We thought about it at one point in time that it was home health, that maybe that was going to be the next, kind of great theater. But I think what we're seeing now is it's just outside, outside of the four walls of the hospital. So now, as you start to expand out into the public, now where's that data sharing coming from? what kinds of mobile device our folks are leveraging. How do we get data from that and start to have that contribute to the actual wellness or the patient status?
Thank you. Anu.
So I think I agree with Deneen's point of view in terms of how the visit may change in the future. I think that what I would add to that is I would expect that the patient would have ways to manage their own disease and get information and get treated and get care as part of living their lives. I mean, today, when you get sick or when you need care, your life kind of has to come to a halt. Right? You plan for the drive to the doctor's office. You end up waiting much longer there than you ever anticipated to wait there. Then you get 6.5 to 7 minutes of a conversation with a guy or a gal who's standing behind an EMR banging away at a keyboard. Right? And then as they're leaving and they're out the door, you're stopping them because you have 3 questions that remained unanswered. And you're back in the car for a drive home and you go, darn, still forgot these 2 questions that I had, right? And that has to change. So I think consumers, patients will demand that their healthcare be delivered more in their terms and more as part of their lives versus the doctor's life, which I think is partly around healthcare being anywhere. I think there's technology and psychological research which talks about, quote unquote, addicted apps, right? There's research which basically says we all get a dopamine hit when we go look at an email, when our cell phone pings, things like that. Why can't we take some of that and actually turn that into a positive thing about healthcare? So I think we will see some innovations around that.
Terrific. Thank you. Dr. Blatt?
I think a visit might start a little bit differently than it starts today. I think a patient might begin by doing some research on why they're going to the doctor. They might pull up an application like iTriage. If the visit is mostly about knowledge work, or about cognitive interaction, I think it's very likely the visit won't take place face-to-face. It'll be probably in some virtual space. It might be an IM, a chat, a video conference. It might also occur at 2 a.m. And it might be at any time, anywhere. And I'm not necessarily waking you up at 2 a.m. I'm talking to that English-speaking doctor in a different time zone because he's awake and alert and I didn't wake you up and he's got a better cognitive process at that point. If it's for routines that are almost algorithmic, I think you're going to start to see the rise of avatars. I might do an intake interview. If it was something like mental health or depression, maybe I would the app calls up an avatar and I'm interacting with an avatar. And that avatar might be racially and culturally specific to me. It might even be language specific to me, which would have me open up a whole lot more if it spoke a friendly dialect, if you will. If the visit is likely to be procedurally oriented because you did some research and it's something that somebody's going to need to touch you with, I think the visits are more likely to be face-to-face. I think you might have a genomic profile in 6 years. It's pretty likely that a significant or a non-trivial part of the population by then will be sequenced. So instead of prescribing Wellbutrin 200 milligrams BID, I'm going to give you 62.8 milligrams every 3rd day. And I know that's the right dose to get a therapeutic level for you. There's going to be a lot less guessing. Pharmacogenomics is probably going to be one of the first places that we see really significant advantages in medical dosing. So I think the consumerism, people self-select to how they approach. Do I want to go into the bank? Do I want to do online banking? Do I want to do, how do I want to approach the doctor? Some people are going to say, hey, it's Tuesday, it's time to visit the doc, and I'm going in. And others are going to go, under no circumstances do I want to see you face to face. It's a waste of time.